With Terumo's Medisafe Mini, any user can easily monitor his or her blood glucose. The power button and recall button are regularly used in your daily blood glucose monitoring. You will also use the ejector to remove the test tip as well as the tip attachment. The lancing depth of Terumo's lancing device Medisafe Fine Touch can be selected from 5 levels so that the physical burden on users can be reduced as much as possible. The lancet has the same form as that of an injection needle in order to minimize the lancing wound. Take the following 2 preparatory steps before using Medisafe Mini for the first time. The first step is battery installation. Slide open the lid on the back side of the reader by pressing the part with the triangular mark. Take out the 2 batteries from the carrying case and place them in the reader with the plus ends facing up. The plus ends of both batteries should face upwards. Slide the lid along the grooves by pressing the part with the triangular mark to close it. Now battery installation is complete. After installing the batteries, be sure to set the date and time. Push the power button with the protective cap on. You will see the indication shown here on the display. Press the Time Set button on the right side of the reader. The last 2 digits of the year will start blinking. Press the Recall button while the year is blinking to increase the number. Press the Power button to decrease the number. The numbers will increase or decrease at greater speed if either button is continually held down. Set the year. Then press the Time Set button. The year will stop blinking and the month will start blinking. Set the month by pressing the Power or Recall button. Press the Time Set button again to set the day, which will start blinking. Set the day by pressing the Power or Recall button. Repeat the same procedure to set the hour and minute. When you press the Time Set button after setting the minute, you will hear a beep and see the year indication disappear from the display. Setting of the date and time is now complete. Prepare the necessary items for blood glucose monitoring. You will need the reader, a test tip, the lancing device, and a lancet. Store these items in a carrying case to keep them handy for your daily monitoring and for when going out. Wash your hands thoroughly. Dry your hands well. Be aware that wet hands may cause incorrect or inaccurate measurement. Turn on the power of the reader without removing the protective cap. As you can see, all the indications appear on the display once, followed by the present time and date. Slide the ejector forward to remove the protective cap. Peel off the film from the test tip. Push the tip against the tip attachment. Pull off the tip case gently. Be sure to pull it straight out. The blue tip should remain on the reader. You will hear a beep and see OK on the display. Let's view the process once again. Push the tip firmly, then gently pull it straight out. You will need to use the tip case again later. Do not throw it away. Next, prepare the fine touch lancing device. Turn the dial of the lancing device to set it to the lancing depth you desire. Align the depth of your choice with the triangular mark. Choose the depth indication of heart or 1 if you have soft or thin skin. Choose 2 or 3 if you have skin of average texture. Choose 4 if you have hard or thick skin. Try a shallow depth first when determining the depth suitable to you. The larger the number, the deeper the lancing will be. You cannot choose a depth between two numbers. Be sure to align a number with the triangular mark. Next, attach a lancet to the lancing device. Let's watch this again. Hold the base of the lancet and push it against the lancing device until the sleeve of the lancet comes in contact with the convex part of the lancing device. Be careful not to push the push button. You do not need to pull the set lever either. If you accidentally push the push button while attaching a lancet to the lancing device, pull the set lever until you hear a click. Hold the base of the lancet and twist the orange cap to remove it from the lancet. Do not throw away the removed cap. You will need to use it later when you throw away the lancet. Let's begin the blood sampling. Select the side of your fingertip as the lancing site. Keep your hand below heart level. And massage your finger from the base to the tip in order to promote blood flow to your fingertip. Place the lancet lightly against your fingertip and press the button with the word "Press" written on it. Let's see the procedure from another angle. Lightly squeeze the area around the lancing wound to make a drop of blood about 2.5 millimeters in diameter. See the blood drop size indicator on the side of the lancing device for reference. Check to see that OK appears on the reader display. If nothing appears on the display, press the power button and wait until OK appears. Dip the tip gently into the blood drop. The blood will be drawn into the tip automatically. Watch the procedure once again. Do not move the tip until you hear a beep. Place the reader gently on the table after you hear the beep. Measurement will start automatically. The measurement will appear on the display with a beep. Place your finger on a support for easy blood sampling if your hand shakes. Remove the blood from your lanced finger with a tissue paper and cover the wound with an adhesive tape to keep it clean. The measurement will be automatically stored in the memory together with the time and date. Cover the tip with the tip case you removed before measurement. Slide the ejector forward to remove the tip together with the tip case. Keep pressing the power button for longer than 1 second to turn off the power. It will automatically turn off after 2 minutes, even if you forget to turn it off. Be sure to cover the used lancet with the cap when removing it from the lancing device. Place the protective cap back on the reader before putting it in the carrying case. Dispose of used test tips and lancets safely by following the instructions of a hospital or physician. Wet a cloth or tissue paper with a small amount of water or rubbing alcohol and wipe dirt from the reader and blood from the tip attachment area. The reader has a memory capacity of up to 150 measurements. This recall function is convenient should you forget to record a measurement. To recall past measurements, press the recall button while the power is on. You will see the latest measurement on the display. Each pressing of the recall button will recall a past measurement in retrospective order. You have just received basic instructions for using Medisafe Mini. Please contact your nearest Terumo dealer or the service center if you have any questions. Follow the steps described from now on to switch the measurement unit. Make sure the reader is turned off. Press the power button twice while pressing the time set button. The arrow mark will move up or down each time the recall button is pressed. Move the arrow mark up to set the measurement unit to millimoles per liter and down for milligrams per deciliter. Press the time set button to complete the measurement unit setting procedure. Correct measurement may not be obtained in the following situations. Repeat the measuring procedure correctly. Correct measurement may not be obtained if the test tip is removed from the blood drop before you hear the beep. Keep the test tip in the blood drop until you hear a beep in order to draw enough blood. Correct measurement may not be obtained if the test tip is kept dipped in the blood drop too long after the beep. Blood starts to coagulate immediately after coming into contact with air. Correct measurement may not be obtained with coagulating blood. Draw the blood as soon as the drop becomes 2.5 millimeters in diameter. Correct measurement may not be obtained if you remove the test tip from the blood drop and dip it in again to draw more blood, because air may be in the test tip. Replace the test tip with a new one and draw blood only once. When blood is forced out from a wound that is too shallow, a transparent intracellular fluid from the subcutaneous tissue will mix with the blood. This may cause incorrect measurement. If you have difficulty in drawing blood even after massaging your finger, adjust the lancing depth. When the test tip is left to sit too long after the film is removed from it, the test strip inside may become moist. This may cause a lower than actual measurement. Use the test tip immediately after removing the film. Here is what you should do when unusual indications appear on the LC display. Contact your nearest Terumo dealer or the service center if the condition is unchanged after performing the troubleshooting described from now on. An inadequate amount of blood is the cause. As you can see, blood has not reached the inside of the test tip. Wipe the blood from your fingertip. Start the measuring procedure again with a new test tip. After lancing your fingertip, wait until the blood drop becomes 2.5 millimeters in diameter to draw blood. This is not a malfunction. Press the power button again. The batteries are running out. Replace both batteries with new ones soon. Measurement cannot be performed because the batteries are out. Replace both batteries with new ones immediately. Be sure to use CR2032 lithium batteries. The temperature around the reader is either too high or too low. Take the reader to a place where the temperature is appropriate. Wait for 20 minutes until the display goes out and start measuring again. A measurement made in high or low temperature may not be accurate. Measure again in a place with an appropriate temperature. The measuring window of the reader may be covered with dirt or dust. Remove the test tip and inspect the measuring window. The indication will disappear once the measuring window is clean. Wipe the measuring window with a cotton swab if the indication does not disappear. Conduct a dirt check with a reader check tip after cleaning. Measurement cannot be made because it is too bright. The L will disappear if the test tip is pointed away from the light or the reader is taken to a place away from direct sunlight. Continue the procedure if the test tip is free of blood. If blood is on the test tip, replace the tip with a new one and measure again. The attached test tip is not straight, or the test tip is not attached securely. Attach the test tip securely if blood has not been drawn yet. If blood is on the test tip, replace it with a new one and measure again. If a used test tip is attached, replace it with a new one and measure again. You will also see an indication when the measuring window inside the tip attachment is covered with dirt or dust. Wipe the measuring window with a cotton swab and attach the test tip again. If you still see no, contact your nearest Terumo dealer or the service center. The test tip became dislocated during measurement. Replace it with a new test tip and measure again. Measurement cannot be performed because it is too bright. Point the test tip away from the light or take the reader to a place away from direct sunlight or strong electric light and measure again. If the test tip became dislocated during measurement, replace it with a new test tip and measure again. Malfunction. Contact your nearest Terumo dealer or the service center. Blood glucose level over 33.3 millimoles per liter or 600 milligrams per deciliter is indicated. Start the measuring procedure all over again. Consult your physician if you still see the same indication. Blood glucose level below 1.1 millimoles per liter or 20 milligrams per deciliter is indicated. Start the measuring procedure all over again. Consult your physician if you still see the same indication. Press the power button once again. Reset the reader if nothing appears on the display after pressing the power button. You can reset the reader by removing the batteries for 5 seconds. The reader will be activated once the batteries are installed again. The memories of measurement results are not erased even if the reader is reset. The clock incorporated in the reader is stopped while the batteries are removed. Set date and time again. The batteries may be installed incorrectly or they may be old. Install the new batteries correctly or replace both batteries with new ones. Contact your nearest Terumo dealer or the service center if you still do not see anything on the display. This is the procedure for checking the condition of the measuring window. A reader check tip is used. Make sure the power of the reader is turned off. Press the power button while pressing the recall button. Take out a black reader check tip from the carrying case and attach it to the tip attachment. Press the recall button again. Yes on the display indicates that the condition is normal. Remove the reader check tip. Return the reader check tip to the carrying case and start measuring. No may indicate that the measuring window of the reader is dirty. Wet a clean cotton swab with a small amount of water and wipe dirt or dust off the measuring window. Perform the same checking procedure again after cleaning the measuring window. If you still see no on the display, contact your nearest Terumo dealer or the service center. Read the user's manual carefully before using Medisafe Mini to ensure correct use.